We're discussing today recognizing mental health in young children.
70% of athletes quit the sport that they have been doing since they're 5 years old by the age of 13.
I feel like a lot of times when a child comes to you with a problem, your instinct is to try and fix it.
Because of the pressure, because of their inability to work through things that are going on for them, and because they give up what they love because they don't know how to cope.
And when you talk about speaking with your child, I think it's really important to use self-control.
As parents, we want things to be a phase sometimes, right? Nobody wants to see their child struggling. Nobody wants to see their child going through something that they're afraid of and not knowing if they're able to help them or what the future looks like. It could change the entire trajectory of their life.
Hello, and thank you for joining me. Welcome back to another episode of Candid Minds with Dr. T and friends. I'm Dr. Tamir Aldat, addiction psychiatrist and the CEO of Mindful Care, and joined today by my dear friend and colleague, Jackie Gilday, a licensed clinical social worker. Jackie, thanks for joining me. We're discussing today recognizing mental health in young children, an important topic that oftentimes is difficult to unpack, particularly if parents are navigating a sea of emotions as children are growing up. And what I want to understand with you today and with Jackie is, why is it important to appreciate that mental illness could appear at a young age? Not everything is quote unquote normal or part of development, and what to look out for if something is striking to a parent or concerning. So certainly an important topic. I'm excited to unpack it with you. What would you say, a lot of parents talk about things being a phase, and that sometimes you're hopeful that a child is going to grow out of whatever they're experiencing. As a clinician, from the patients you've worked with, when have you felt that it transitions from being something transient to something concerning?
Sure. I personally do feel that the term "it's just a phase" could be a very dangerous phrase. I think that as parents, we want things to be a phase sometimes, right? Nobody wants to see their child struggling. Nobody wants to see their child going through something that they're afraid of and not knowing if they're able to help them or what the future looks like. But also nobody wants to just start diagnosing their child at 6 years old and, starting to lay diagnoses on them that may not be, right? And so there are things that are age appropriate. But I also always like to encourage family members and parents that your child. And anytime there is a major shift where maybe they're not engaged anymore. Maybe they're isolating. Maybe there's a shift in how they're communicating with you. Being aware of it, but also having those conversations and not being afraid of it. And I think a lot of times what we hear later on in life is, I was struggling. I didn't know how to say I was struggling, and nobody asked me if I was okay. And so, adults end up having to recover from their childhood, from things that maybe could have been a phase, because they didn't feel supported from it. And a trauma comes from something that really wasn't maybe a huge deal, really based off of how people around them supported them or did not support them. And so I think that, no parent wants to hear that their child is struggling. I most certainly do not. No parent is able to navigate that without their heart feeling heavy, right? Watching the person that you love more than anything in this world with all of your being having a hard time is not an easy thing to navigate. But also having a level of awareness and understanding that if this is not a phase, what can I do to help them? Asking those questions. And so, I would say is really pay attention to your child. You know them more than anybody else knows them. If you are seeing that there has been a major shift, then start to communicate about that, and it's age appropriate, right? If it's a 13-year-old, you don't want to really be hounding them nonstop about what's going on, but it's okay to ask. It's okay to ask questions. It's okay to say, if something is going on, I am here. And also as parents, we are so engaged in many different things, our children, work, after school activities, that sometimes these big behaviors start to show up and we think they're tired, they're hungry, they're just being difficult. But if those behaviors are persistent, taking that moment in that moment to understand something may be going on here. And I think that that's a lesson that I recently learned, is that there were some shifts in one of my children. And the second I approached it differently, the second I stopped trying to battle it with my daughter trying to be maybe having conflict or being resistant to my parenting, and just asking a basic question of, is everything okay? Is something going on? It opened up a line of communication that I really wasn't ready for, to be honest. I wasn't expecting it, but it also then a couple of weeks later has subsided because we've talked about it, we've addressed what's going on, and we're moving forward from it. And things really fester with kids in different ways, and they tell us things even though they're not always able to vocalize it.
Absolutely. And a lot of times parents ask me, what should I look out for if something is concerning? And three things come to mind, really. One, I would assess if a reaction is very disproportionate to a certain situation. And usually then parents say, how would I know? And you really would look at their peers. And would their peers react the same way? Are their peers reacting the same way? Or do you find a major difference in the way they're handling a certain stressor compared to their peers? And if there's a major gap, that's something I would want to explore. Is their response to a situation constant and permanent, or something that is transient and fleeting is another one? A lot of times changes in mood, sleep, appetite, anxiety, temper tantrums,
interest, things that they used to like to do.
If those are fleeting and cyclical, that tends to be a lot more reassuring than if the change is permanent and constant.
Sure.
So exploring that is the second. And the third, I would really want to assess if there's been a sudden major change versus gradual in a way a child is responding to something.
Right.
So when we see adolescence, it is a major shift.
Right.
But if you look at those three categories I just gave you, the onset is usually gradual. They're responding the same way their peers are responding. And the reaction is usually cyclical, fleeting. There are periods where they very much are engaging in normal, and then there are times where they're extreme,
right,
making it less alarming. So testing it through that, that's not a scientific paradigm, but that is like a little litmus test that I try to tell parents to look at a situation to assess if something is concerning.
Mm-hmm.
But from your perspective, let's say I am a parent and something is concerning, what would be my first step?
One is having the conversation with your child. You would be very surprised in what they could tell you and what they sometimes are willing to tell you if you would approach it in an appropriate way. And then two, not being afraid to involve other people. I think for a very long time, and I know even myself, is we worry about what people will think of us. We worry about perceptions. We worry about making something bigger than what it actually really is. And so we're afraid. And, it's okay to write into the teacher and say, I'm noticing at home this. Are you noticing it there? It's okay to say, you know what, this is something more is going on here. I think I need to get a little more support, whether it be through school or an outside therapist. But not being afraid to utilize resources. And I think for a long time, because of the stigma with mental illness,
sure,
people were afraid, and sometimes still are, to make others aware of what's going on. But you would be surprised of how other people can support your child in that. And so, but for me and for a lot of people, is getting support early. And that doesn't mean therapy, doesn't mean you have to put them in therapy, but just having people aware and talking to them, and it not always coming from just the home, is a huge component. And also for yourself is getting yourself the help through it, because that can be difficult too, is when it really may be identified that something is going on with your child, is we may handle it wrong. We may put inappropriate pressures on our child. We may just want to fix them. And that's not always the case. And that causes a lot more distress than being able to sit with it and sit with your child and really work them through what's going on. And helping them to understand too is huge. You have to remember that these are little human beings as well, right? And they have very big feelings, and if they don't understand it, they expect that you are. And we don't always respond appropriately to our kids. That's just the bottom line, right. So just really supporting them, not being afraid of getting help, but also being their biggest advocate. I think that that's huge. Is understanding that if you, as a parent, if you really feel that something's going on and that we're missing the buck somewhere, not being afraid for advocating for them and getting them the help that they need.
Yeah, getting the help that they need is an important point because I see this a lot with early intervention.
Yes.
Particularly children under the age of 3. Parents are scared, nervous, don't know how to navigate their school district and early intervention programs. They age out of early intervention, and nearly 100% of the time, they regret not using all the tools and resources available with early intervention. And that's just one example.
Yeah.
Where had parents been more bullish and didn't fear the stigma and the judgment and sought the help, it would have made a really big difference.
It could change the entire trajectory of their life. Teaching them, getting them help early rather than having them to go through this whole time of like not knowing as an adult what's wrong with them and not helping them to understand, and also seeing I was worth it. They cared to get me the help, whereas I cannot. Handfuls and handfuls of patients that I have treated, adults who say to me, I was begging for help and they weren't helping me. And it's not that the parent didn't want to, they couldn't accept it. They couldn't accept that something was going on. Maybe they didn't understand what resources were available. So when you say, a parent being bullish, I have to encourage you to do that. There's nobody in this world more important than your children. And when it comes to them, you do whatever you have to get them the help that they need, to support them and to make sure that the people around them are supporting them as well. 100%.
Another thing that comes to mind is the obligation of a parent to fix.
Yeah.
And I feel like a lot of times when a child comes to you with a problem, your instinct is to try and fix it. And when you talk about speaking with your child, I think it's really important to use self-control, and you impulsively want to fix, but not to do that. To really validate what they're saying, normalize what they're saying, and even use silence to create a space where they can come to you and share with you what they're experiencing. A good example of this could be a child getting into your car from school and telling you they had a terrible day and slamming the door. And your initial reaction might be like, don't slam the door like that. What happened? Let me know. Who do I need to call? What do I need to do? We're going to fix this. Relax. When in fact, you could just say, it sounds like you had a really rough day. And then I would pause and actually say nothing. And more often than not, it'll cue the child to tell you what happened without you prying.
And validation is huge. I mean, we see it all the time, as well as growing up as a child, not feeling like your feelings are validated. It continues with you throughout your life. And so that component is like, as a parent, we want to fix the behavior that's associated with the emotion. Right. And that's where we're going wrong. And, I'll tell you, it's my biggest challenge too, is because I don't want my child to be disrespectful. I don't want her to come off the type of way. But the fact of the matter is at the end of the world that she slammed the door because she had a bad day? No. But it could be the end of the world if I don't address that she had that bad day, if I don't acknowledge those feelings that she's having, and I don't have that conversation. And so society has us so fixated on fixing the behaviors of, you're wrong, you shouldn't have done that, rather than asking, why did you do that? What's going on? How can I help you through it? And I think that that's huge that you said that. Validation is huge. The communication component is huge. And just being there. As parents, we want to fix everything. As a mom, I want to fix everything for my kids. I don't want them to feel anything bad, right? But that's not practical. In life, they are going to feel these emotions, and helping them guide them through it while also guiding myself through my emotions. Because I'll tell you, I've never felt the way I feel as a mom these days. You get triggered very easily. You want to rescue right away. You want to fix everything. But that's not how life goes. Mommy can't just come in and clean everything up all the time. And allowing them to understand that these feelings will represent, so that when they do, that there's ways to cope through it, is huge.
Have you seen some cringeworthy validation on social media? Because I feel like I see everyone talks about validating, but then I see people giving advice of really just echoing what the person says as a form of validating. And I know for my kids, if I did that, that would drive them nuts. Like if my kid said, I'm really angry we lost. And then I told them, it seems like you're really angry that you lost. And that's like ineffective validation.
What's
and
so wrong with saying it sucks that you lost?
that's what you should say.
You worked really hard for this and it really stinks that you're having a hard time. And that's where I think we're going the other way,
Yeah.
right? Is that people are afraid to communicate. So they're just rephrasing what the child says and that just triggers frustration.
Totally.
We're just saying, it's, you know what? I'm sorry you're having this hard time. You know, you worked really hard out there and you fell short and that's okay. Right. And, you know, it's going to stink for a little bit. You're not going to like the feeling. You may go to school and be angry, you know, again, that you lost and you worked so hard at it. But I think we've come to a place where we don't want to say negative things to them either. We don't want to address the negative in life, but it's like, what's that doing for them? What is that teaching them? I
Right.
think we've talked about this,
We have.
you know, you're very realistic when you're on that field with your son. And I think that that brings a level of maturity in a child that is okay to bring, that needs to, and that's missing a little bit. And just saying, you could have done better, you know, it did stink, but there'll be many other games and you'll get through it. Or saying when the championship game comes around once in a lifetime and they do not win, being like, you know what, this hurts. It stings. And
Yep.
not, you're going to go back. And, you know, they don't always want a pep talk in the moment. They want to feel heard and validated and they want to be supported through it, which brings up a good point. I've been doing a lot of reading on athletes as of recently. And I recently read, being last night, that 70% of athletes quit the sport that they have been doing since they're 5 years old by the age of 13 because of the pressure, because of their inability to work through things that are going on for them, and because they give up what they love because they don't know how to cope. I think that's huge. That speaks volumes about what's going on with children's mental health. Is that, are we applying pressure too soon for them? Are we giving them the grace that they deserve as a child? And are we supporting them mentally through these challenging times in sports and in other areas in school so that they don't fall to mental illness, so that they don't leave the sport that they love so much because they don't know how to cope through things?
Yeah, no, I think that is a very good point. And one way I try to navigate that is compare him to himself and
Right.
not just to his
Right.
team. So sure, we might have lost the game, but if you look at the way you played 5 games ago, you didn't score at all. This game you scored once. That is a win in and of itself. So trying to kind of find little wins along the way is helpful. And that does create a silver lining of sorts to keep him motivated.
Yeah.
But
They're growing up
not
in a
easy.
very different world. They're growing up in a very different world that we grew up in, and we have to. There's no book that comes and says, okay, it's 2025. This is how you parent your child. We're learning as well. And although we learned from our parents, they weren't raising kids that were growing up in that world, right? And so between social media and all these array of different things that they have access to, it's difficult to navigate. And it does trigger, you know, certain things for them. It doesn't mean that your child's mentally ill because they're having a hard time, right? But it also doesn't mean it's a phase either. And so being okay with not putting a title on it and not, you know, having to define what exactly is going on, and really being more focused on supporting them through whatever it is, because it's going to come and go possibly, or it may stay. And if it stays, helping them to understand that you're going to stay, you're going to support them through it, and you're not going anywhere.
yeah, being that permanent anchor is
Yes.
huge. So I think we raise a lot of valid points. I would encourage parents, if they feel that something is going on, it never hurts to ask a professional and seek help, and doing it sooner rather than later is certainly important. So to our listeners, thank you for joining us. A lot of knowledge here about how to appreciate mental health in children and communicating with them to make sure they're successful. So we appreciate you tuning in and look forward to seeing you again on our next episode.